Hello students, good morning. Today we shall learn about the two simple topics, which is hypotension and hypertension. So by now the term is very familiar to you guys. So what is hypo means low and hyper means high blood. Now what is hypertension and how would you record or what would you demarcate as a low blood pressure? So when you record the blood pressure, which I hope you all do know how to record the patient's blood pressure, and when you know that it is systolic by diastolic, and when you see the numbers less than 90 by 60, then that is classified as a hypotension. And the first and higher of the two is a measure of systolic pressure, as you know, or the pressure of the arteries when the heart beats and fills with the blood. So this is what it is. So I'm not going to explain this in detail because you know what this is, what is hypotension, and you have learned this how regarding the recording of blood pressure. And I'm sure in that at the time this would have been suggested to you what is a normal and what is low and what is high. So obviously it is recorded as systolic by diastolic. So systolic blood pressure less than 90 is considered as high. Now what are the etiological factors for this? So various factors are responsible for causing hypotension, which includes, it could be due to some kind of hormonal changes or issues or disorders. Pregnancy can also be one of the factors. Heart failure, liver disorders, heart arrhythmias, widening of the blood vessels, which means there is dilation, and also some of the drugs can also cause your blood pressure to drop, and it can also be due to heat stroke and also severe exhaustion, and sometimes some of the prescribed medications or the drugs can also be leading to this particular condition. Now hypertension, this is just explaining to you in detail. Now different classification of types related to vasodilatory, obstructive, cardiogenic, toxicologic, hypovolemic and metabolic. Means what there are certain reasons why this particular hypertension has occurred. So vasodilatory, as we explained to you, is nothing but your widening or dilation of the blood vessels. Obstructive is nothing but something which is causing a block. Cardiogenic is related to your cardiac. Toxicology, again, any sort of sepsis or any kinds of toxic substances. Again, this could be overdose of drugs and medications for a long time. Again, that can also cause. Hypovolemic is something but when you lose your volume of blood. Again, it could be some sort of hemorrhage or injury or trauma, whatever, that has caused a lot of fluid or volume loss that can also lead to this kind of low blood pressure. And also it could be due to metabolic related, which is associated with your hypothyroidism or hypoadrenalism. What are the clinical manifestations for this condition? Yes, the patient is going to be feeling dizzy or lightheadedness, fainting, blurred or fading vision or faint vision, nausea, vomiting, as well as lack of concentration. And again, always you know that yes, when you're losing this, again the patient can go into extreme shock conditions, and the signs of shock again will include like confusion, cold and clammy skin, rapid shallow breathing, weak and a rapid pulse. How do we diagnose this particular condition? Yes, it can be done through blood test, urine test, ECG, Holter and event monitors, echocardiogram, stress test. Valsalva maneuver is something but like it's something where you're trying to hold your, and you, the way you you're trying to hold your, you're trying to breathe out but with your mouth as well as your nose. So that is another way of restoring this kind of condition. And also a tilt table test. So this will actually tell you when your blood pressure is dropping, when the patient is standing almost in a tilted position, or when your head is tilted down or your head is in the up position. So all these are the various ways of checking out when the patient is actually feeling these signs and symptoms. The guidelines for recording blood pressure, I'm sure this is also being discussed with you when the classes were taken regarding how to record the blood pressure. So obviously make sure the patient is in a calm and quiet condition. Make sure the patient is comfortable, sitting quietly, and explain the procedure to the patient. Important that yes, you have to provide him privacy, and also make sure you do not touch him with your cold fingers or arms, and also telling the patient to sit, relax, and not keeping the legs crossed. Very important. And first of all, very important that wherever the patient is just walked in, ensure that he's comfortable, he's breathing relaxed, he's not restless, and only then you do the normal recording of blood pressure. But importantly, yes, privacy and explaining to the procedure also is very important, even though it is a very simple procedure. And once it is done, it is to be recorded and done. And the other way is, once you know that yes, the patient is having this particular condition of low blood pressure, then yes, very important is you need to restore that kind of blood pressure or volume again. Such patients, yes, it can be restored immediately by having adding more salt into the diet or drinking a lot of water just to keep up or pump up the volume. Wearing compression stockings, which are nothing but the tight stockings or the socks kind of things that you wear, so that it compresses the blood vessels and is actually pushing up the blood. And also medications to help improve the. Lifestyle and home remedies will include drinking more water, less alcohol, paying attention to the body positions, especially when you know that you're, yes, you're feeling low, then again make sure you drink water, and then you're making sure that your legs are raised. This is one way of getting the blood pressure back to the normal numbers. Eating small and low carb meals, also exercising regularly, and in case you're on medications for that, make sure you take your medications on time. The next topic is hypertension. So we finished hypotension, which means low blood pressure, and hyper means high blood pressure, and in which means the blood pressure in the arteries is going to be very, very high. Okay, so that is what it is causing the particular condition called as hypertension, or nothing but high blood pressure in the arteries. So the first picture here is showing you that no hypertension, and the heart is pumping very, very normally. But again, what happens here in the heart when it is high blood pressure, then what happens? Blood may not flow easily through the blood vessels. So again, there is low high blood pressure, and this picture again shows you that how much of pressure it actually puts on the arterial walls. So again, you can see that this picture here again, it could be to various reasons again. So here, this picture here, you're seeing the yellowish deposits on the walls, and that's nothing but your plaques or atherosclerosis, and the arteries near the heart become more rigid and less able to expand. More force from each heartbeat is passed along to the rest of the blood vessels, and this can raise your systolic blood pressure. So this is what it is, that is what causes a particular condition. The picture here is actually showing you what a normal arterial wall looks like and how it is. You'll see the diameter, but again, when there is some kind of plaque buildup, then that actually narrows, and this is what starts to cause the actual condition of putting a lot of pressure on the walls of the artery. So here again, you can see there is so much of narrowing. More than half is actually being blocked. So again, you can imagine the kind of pressure for the wall. Now, etiological conditions or factors again is nothing but various causes for this will be salt, obesity. Salt again means high salt in your diet, so that can cause a lot of high blood pressure situations. Obesity is your body weight. Inactivity, that means no physical activity. Alcohol, genetics, smoking. Low potassium and calcium and magnesium and also stress can also add on to this particular condition. So hypertension can be of two types. We can classify it as cardiac output and also systemic related or vascular related. So cardiac is totally due to your cardiac disorders why it can occur, and this is nothing but related to your blood vessels, and this is also due to other kind of conditions apart from your heart conditions why it can be caused. So it can be due to stress. Atherosclerosis again, buildup of plaque in the arterial wall, so it is not just the heart, anywhere in the body. It can also be due to some kind of kidney disorders or diseases. Thyroid disease or thyroid dysfunction, that can also lead to this. Diabetes and also cerebral ischemia, which is but even the brain vessels are not able to receive that adequate blood and oxygen. The types of hypertension mainly can be classified as primary hypertension and secondary hypertension. And primary hypertension, again, the exact cause is not known. It could be due to some kind of positive family history, or increased salt intake, obesity, as well as stress. Whereas the secondary hypertension, again, it can be due to other secondary conditions or comorbidities, which, as I mentioned to you, it can be related to your renal, endocrine, or due to some certain drugs and any other conditions related to the heart as well. Okay, so this is what is a classification of secondary. This, you can just go through this saying about what really happens there, and why what goes on during this condition. So it could be all due to your etiological factors, genetic as well as environmental factors. Again, what actually goes on? So there is defects in the renal. This affects the kidneys. Okay, so that is what happens, and inadequate sodium excretion, and eventually what is going to happen? You will see there is going to be decreased cardiac output. Okay, and again, this could also be that it could be again renal sodium hemostasis. So also can be due to functional vasoconstriction, and also defects in the vascular smooth muscle growth and structures. Can also be any kind of all the etiological factors that we learned, and as I told you, it can be associated with any other any disorders of other organs as well. So that can also cause, and this can cause high resistance in the walls of the arteries, and this is what ends up in having the patient having this particular condition as hypertension. The main clinical manifestations for this particular condition, yes, breathlessness. The patient is going to be feeling difficulty in breathing, severe headache, bleeding from the nose. Again, it's due to high pressures, fatigue and sleepiness, profuse sweating, as well as blurred vision. So this is what occurs, and these are the symptoms of high blood pressure. Complications again. Due to this pressure, as I told you, it can affect any portion of the patient's body, and this can put a lot of pressure either in the brain or in the heart, the kidneys, as well as even the eyes can be affected, because again, even though the tiny blood vessels with the high pressure can actually damage or it's ruptured, so anywhere it can affect, leading to a stroke, blindness, heart attack, heart failure, or even the kidney failure. How do we diagnose this particular condition? Now, this American Heart Association has given us certain characteristics about what a normal blood pressure should be, and when would you classify it as a pre-hypertension, when is it called as a hypertension, and when it is called as a hypertension crisis, means it's an emergency condition. So a normal, as we know, yes, it is less than 120 and less than 80, and pre means something anywhere between 120 to 139, and diastolic can be anywhere between 80 to 89. Hypertension, where we always state, again they have classified it as stage 1 and 2, so anywhere between 140 and 159 is called as stage 1 hypertension, and diastolic can be anywhere between 90 to 99. Stage 2 again is anywhere between 160 to higher, or 100 or higher. And hypertension crisis is nothing but higher than 180 and higher than 100. So anywhere about this, yes, it's marked in red, means yes, it is critical, or there is. Now, high blood pressure redefined. So this is by the American Heart Association, because every year what we're trying to do is we're trying to get the health better. Okay, so even the American Heart Association works on that, and what we're trying to do is we're trying to bring down the numbers here. So that is when we say that yes, you achieve optimum health, or this is the levels for having optimum well-being. Okay, so that is when we say that this is a refined categories of the high blood pressure. And again, we are classified it as normal, high, elevated blood pressure, or nothing but slightly high, high blood pressure stage 1, high blood pressure stage 2, and also hypertensive crisis. Okay, so this is what it is. Even here you see the hypertensive crisis, the previous picture showed it is 180 and then 100, so but here it is saying that higher than 120, so they've given that margin. So again, all this is going to put the people or the individual also in a bit of cautious aware of what they're going to be eating, and also how much exercise to be done, and what is actually going to be the optimal level of blood pressure. Now, the management for this particular condition, yes, medical management, you will be on medications which is going to take care of your blood pressure. So beta blockers, for example, propranolol, alpha blockers, which is nothing but terazosin, vasodilators, which is going to be when there is constriction, that is when the blood pressure increases, so we need to help the blood vessels relax, so nitroglycerin, calcium channel blockers, nifedipine, and diuretics, very important, so because we don't want any sort of congestion and causing edema in the extremities, or any kind of puffiness and swelling. So all that is nothing but the fluid or volume overload. So all this has to be taken care of, and for that it is nothing but diuretics, or the most common drug is Lasix or Fruits. The nursing management for this particular condition, yes, the nursing diagnosis will increase risk for increased cardiac output. Yes, there's not going to be enough output. Again, you understood what the condition is about. Acute pain, yes, there can be severe pain related, as I told you, there could be severe headache, or due to this particular high blood pressure. Ineffective tissue perfusion, activity intolerance, anxiety, and as well as vision. Lifestyle modification, or kind of education that you give the patient and family. Yes, it could be related to your weight reduction, dietary support, reducing alcohol, and increasing exercise, as well as managing your stress levels. And also, very important is your low sodium diet. Now, the DASH diet, now this is very commonly associated with hypertension. So DASH again is nothing but dietary approaches to stop hypertension. So that is the meaning of DASH diet. Again, it's nothing but it's telling you how you eat a well balanced diet. So you're trying to control your fats, your sugars, your salt, your carbs, your carbohydrates, your proteins, your minerals, your salt, and also your portion of dairy products. Everything has to be appropriate. So that is what we say, that when you have adequate portions of all this on a daily basis, all this is going to be kept. So teaching the patient about self-care, example, it includes how you treat the patient at home, how the patient can take care of himself, and especially when the caregivers also should be given this education about this particular situation. Nutritional therapy, drug therapy, physical activity, blood pressure monitoring at home, and also making sure that tobacco cessation, which is nothing but your stopping the use of tobacco. And with this, we finish this topic, hypertension and hypotension. Thank you for your time.